It's time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence. Dr. Hiatt is in studio with us this morning. How are you?
Good to be here, Chris and Paul J.
And we're always kind of selling ahead, and I guess it doesn't matter what business you're in. Got to keep looking down the road, what's coming up. What's coming up? Last week, a government panel released its recommendations for the upcoming flu season. Good news or bad news for people who don't like needles?
Paul J., this may be bad news for people who have problems with needles, the needle phobic. You see, last week, the Centers for Disease Control and Prevention, that's the CDC, recommended that FluMist not be used in lieu of a flu shot to vaccinate against the flu.
Well, what is the difference between the mist and the shot?
Well, Chris, of course, the mist is sprayed into the nose. It's relatively painless as a result, whereas, of course, the shot involves injection by a needle.
Why did the CDC recommend the shot over the mist?
Well, Chris, although it may hurt less, the mist is simply not as effective as the shot. In fact, last year it was found that that FluMist was about 20% less effective than the shot.
And when you get into like a 20% range, then you really start to notice.
That's a big difference, Paul J.
Huge.
We hear a lot about fake news, of course. It's on TV all the time, and I never know which channel is which. But there's sometimes there's fake health news. Is there a lot of fake health news out there?
There is. There's an abundance of these misleading stories, and we've all heard them. The secrets for losing 50 pounds in 5 days, or how to whiten your teeth, or to reverse those wrinkles. Now, as pertaining to health news, there's also something called junk news in addition to fake news.
Now, what exactly is junk news?
Well, junk news to me is really reporting conclusions that aren't really supported by the studies. So, for example, you may have some study performed on a mouse in a lab, and then to say that it applies to humans may or may not be true. Now, another example is when causation is reported from a study that really only establishes correlation. That is, it may show that A and B are related, but it doesn't necessarily prove that one caused the other. And then a final thing is when announcers, maybe such as myself and others, are somewhat alarmist and say that the risk is elevated. Well, it could be that indeed it's increased if you do something, but that the overall absolute risk still remains extremely low.
I guess the question now is, who can we trust? What is a good source of health news?
Well, of course, this medical moment and other such segments on KBOI.
But a lot of fake news and junk news, too, I suppose, takes advantage of your psyche. I mean, you're getting a little old. This will help you look younger. Your sex drive's not what it used to be. This will bring it back. You've gained a little weight. This will help you lose it easily. It takes advantage of your psyche, right?
Yes, this news is very personal to us. And for that reason, really fake health news could be the worst type of fake news.
We talk a lot about different foods that people eat. People put themselves on sometimes strange diets. But there is a heightened concern that exercise deficits are contributing to the growing obesity epidemic, particularly among children and teenagers. Now, how are adolescents doing with exercise?
Chris, not too well. And this is according to a study from Johns Hopkins published earlier this month. It found, as a very interesting finding and surprising finding to me, that the average 19-year-old is as sedentary as the average 60-year-old.
Holy smokes.
What? Oh, sorry, go ahead.
And furthermore, in this study, it was found that the majority of our adolescents, about 50% of our male adolescents and 75% of our female adolescents, really fail to get the recommended daily amount of physical activity.
What is exactly the recommended guideline for exercise in children?
According to the World Health Organization, they really need at least 60 minutes of moderate to vigorous activity every day.
That reminds me of that Play 60 campaign that we've seen on TV. Now, most of our children and adolescents, though, they're not meeting that guideline.
That's right. Most are not. And this study really highlights the need for them to get some type of activity, no matter how intense it is, just to get up off that couch and get out, particularly on a day like today when it's not too hot, and exercise.
Who's the mantle to fall on to get that done? Mom, Dad, the kids?
All of us together.
Have to all get in and row the boat.
Yep.
Well, Dr. Hiatt, it's been a pleasure having you in the studio this morning. We thank you for your time on KBOI.
Thank you.
It's the KBOI Medical Moment every Tuesday, brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence.